Hello, my name is Kassandra Romas and welcome to 30 Medical Minutes. If you or a loved one are affected by a brain tumor, the Brain Tumor Center of the Atlantic Health System will be able to provide an excellent and experienced team of specialists for a continuum of care. While the news of having a brain tumor can be devastating and frightening, this team of internationally recognized physicians, expert support staff, state-of-the-art resources and facilities provides expert care and comprehensive services. Our guests are Dr. Yaron Moshel, a neurosurgeon specializing in brain and skull-based surgery, Ms. Pat Eagan, Nurse Navigator, guiding patients with a wide range of support services, including making appointments and providing information, and Ms. Claire Weiss, RN, coordinator of the Center for Hope, overseeing a program that brings patients and caregivers together, allowing them to discuss the challenges and successes, yes, success, in living with a tumor. These guests have extraordinary skills and are extraordinary people. They make a potentially difficult situation easier and provide care and hope for all. This is an amazing program with very interesting and wonderful people, so stay tuned to our program, Brain Tumors, Care and Hope. And now let's welcome Dr. Yaron Moshel, Pat Eagan, and Claire Weiss to 30 Medical Minutes. Thank you so much for joining me today on 30 Medical Minutes. It's an honor to have you join me here.
Thank you, Cassandra. Thank you.
Okay, before we get into our very serious topic, I would love to have each one of you give me a little bit of information about your background. And Dr. Moshel, if you could tell us about your background.
So my name is Yaron Moshel. I'm a neurosurgeon. I specialize in brain tumors. I am co-director of the Brain Tumor Center, which was recently renamed as the Gerald J. Glasser Brain Tumor Center. And I work very closely with Dr. Kurt Jekyll, who is a neuro-oncologist that is the medical co-director of the center. And we guide patients through both the surgical and oncologic treatment for brain tumors.
Okay, thank you. Pat, why don't you tell us a little bit about yourself?
I'm a registered nurse, and I have been working in the Brain Tumor Center, which actually at one time was called the Brain Tumor Center of New Jersey at Overlook Hospital since it opened its doors in 1999. So it's been a privilege for me to work in that role and in that capacity. And it's a privilege to work with Dr. Moshel and Claire as well.
Thank you, Pat. And Claire?
I'm a registered nurse, and I work at Atlantic Neurosurgical as well with Dr. Moshel here. I've been a nurse for 7 years now, and mostly we do brain and spine patients. So, and I help from the coordinator with the support group.
Okay. Well, each one of you provides an outstanding service to a patient in the various stages of their care, and we appreciate that. So before we go into discussing each one of the areas that you specialize in, I think I'm going to ask Dr. Moshel to give us a brief overview of the dreaded, scary brain tumor. What is it, Dr. Moshel? Obviously you find it in your brain, but what does it entail?
Well, brain tumors, there are benign and malignant brain tumors, but they essentially represent an abnormal growth of cells within the brain. I often give the analogy of think of it as a balloon slowly inflating within the brain. So depending on its location, it will cause different sets of problems, and depending on its underlying biological activity, it will grow at different rates. So malignant tumors will be more invasive and will grow more quickly, whereas other benign tumors will grow more slowly. The biggest issue with brain tumors is obviously the treatment and the diagnosis. The diagnosis sometimes can be hard. People can have tumors sometimes for quite a while and not realize that it's been there. And then other tumors present relatively quickly, where patients become sick rather quickly and show up to the hospital.
Okay, so I think this is very interesting that you pointed out that a tumor can be benign as well as it can be malignant. benign tumor is one that is self-contained and it has not metastasized throughout the body. Is that correct?
That's right, and it's generally benign tumors are curable with surgery and sometimes with radiation.
Right. Okay. So if a person suspects that there's something wrong, what symptoms would they present with?
So the symptoms of a brain tumor can be varied depending on the location in the brain. I often explain to patients that it's similar to the symptoms of a stroke, but they happen much more slowly. So a stroke will happen relatively quickly. The symptoms from a brain tumor will come on relatively gradually. It can be as simple as personality changes and increased forgetfulness. And some people they'll notice weakness on one side of their body or lack of coordination. And then other times it can be a simple thing as worsening headaches. And sometimes it can represent more serious things like the development of a seizure, for example.
Mm-hmm. I suppose a brain tumor can be in any portion of your brain, from the front to the back. What about if somebody's eyes get blurry? Does that mean they have to go look for glasses, or does that mean that they should suspect a brain tumor?
Well, they should start with an ophthalmologist and get evaluated. There are some brain tumors that can lead to blurry vision. Generally, those tend to be more benign tumors. But yes, it's certainly possible that can be from a tumor.
Can there be severe symptoms such as pain, nausea, vomiting, that type of thing?
Yes, that can happen. Oftentimes, though, the symptoms come on relatively gradually. But sometimes things can get worse very quickly, and the patient can have significant pain, headache, nausea, and vomiting. And that's really the kind of thing that should prompt someone to go to the emergency room.
Okay.
If that's what's happening.
I'm going to tell you, Dr. Moshel, really presents a dilemma, because if it's gradual in its onset and some of the symptoms mimic many other type of illnesses, then it's going to be hard for somebody, even a physician, to suggest that somebody has a brain tumor.
It sometimes is hard. In fact, we worry that sometimes brain tumors are often missed. But I think that this is a situation where patients need to keep coming back to their physician. If you have a problem that really hasn't been explained to you in a way that's satisfactory, you need to keep asking questions and be your own advocate.
Okay.
And, eventually, we'll figure it out.
Right. And of course, we have the advantage now of incredible testing that can be done so that so you can get a diagnosis that's pretty precise. Is that correct?
You can. Usually, the test that you would use is an MRI scan of the brain. And that typically would identify the tumor rather quickly, and it's usually pretty obvious on the MRI scan.
Okay. If a person has presented these symptoms and unfortunately has been diagnosed with a brain tumor, what treatment options are usually presented?
Well, I think if you face that diagnosis, probably the most important thing you can do is go and seek out care at an integrated center. I think you want to seek out, for example, the Gerald J Brain Tumor Center, but a center where you have all the specialists coming together to take care of you in a coordinated fashion. Because it's going to require some element of surgery, it might require radiation treatment, might require some chemotherapy, and you really want all of that care to be coordinated. And then there's so many other support services that people need for treatment of their tumor.
Okay, well, I can certainly see having a team of physicians and support staff, and Claire and Pat are going to make a big difference in providing complete, well-rounded care for a patient. So I know you're a surgeon, I know you're a neurosurgeon, so that means that, Dr. Moshel, you're the person who goes in and actually operates on a person to hopefully remove the tumor. Is that correct?
That's correct, yeah.
And we've had on our wonderful show here before your testimony that you've actually done even live brain awake surgery as well.
Right. The brain surgery has evolved tremendously, and we now are able to cater the operation to the patient and to the location of the tumor. So in the situation you're talking about, There are some scenarios where patients have tumors situated in the speech centers of the brain. So in that case, in order to do the surgery safely and to try to really push the limit as to our ability to remove all the tumor, or as much of it as possible, it's safer to do the operation awake, while so that we can test during surgery that we haven't damaged your speech centers. And there are lots of incremental advances in brain tumor surgery. It's gotten a lot safer, a lot less invasive, and a lot more accurate. Certainly today than 10 years ago, and 10 years ago was better than 20 years ago. So it's really, they're always making progress.
Well, I find this extraordinary, and I think that our audience should know that that it's an extraordinary feat that you can do with your skill to be able to operate and do this on behalf of the patient. So hopefully that you've had a very successful surgery, and people are now coming out of surgery, and they're thrilled that it's over, but they're probably lost insofar as that they don't know what they should be doing. And Pat, that's where you come in.
Right.
So why don't you explain the wonderful services that you provide as a nurse navigator, and why don't you explain what a navigator is? In my mind, a navigator is a person who takes you down a path and shows you the way. Is that what you do?
That's an accurate description, very much so. So it's up to me to meet with generally the person in the post-operative setting. I get the referral, and then I will make an appointment for that person to come back to the cancer center and be seen both by the radiation medicine department and the neuro-oncologist, and many times the neurosurgeon, if it's indicated in that situation, depending upon what the diagnosis is for the person.
Well, you've mentioned a lot of people here, Pat. Are you talking, and the doctor and Claire confirm this for me, is there a team of physicians or a board that you have to refer to guide people through this, or how do you do this? How do you make your decision about what sort of treatment is necessary?
Well, oftentimes patients will come to the surgeon first, and sometimes they'll come to the neuro-oncologist first. But we meet together, we review a lot of these cases. A lot of times we review them individually. I mean, the advantage of being in a center is that myself, Dr. Jekyll, and Pat, we're always calling each other on our cell phones, reviewing MRIs and going over patients. More formally, though, we have a brain tumor board where every case gets reviewed, and we meet every 2 weeks now. We're meeting, going over all the cases, and that's when we come up with a plan, and that sort of Pat uses that information to take charge of the patient journey and coordinates where patients go and who they meet.
And that's why I brought it up, Pat, because you mentioned all these people, and what I understand is that you are working so closely with the physicians, all the physicians in the team, and maybe even liaison with the board, so that you can help the patient, as you say, making appointments to the appropriate people, and maybe even help educate them and give them information about how well they've done, what to expect, what is expected of them. Is that correct?
Yes. It's my job to provide education in terms of what to expect from the treatment plan that has been put forth, any possible side effects, and of course the benefits as well. And you do that both in this setting as well as you give them written information. You make referrals to other specialties or disciplines if they need it, whether it be social services or nutrition, dietitian, that kind of thing. So it's up to me to sort of oversee that piece of it so that the person and their caregivers aren't sort of lost at sea. They have someone who will help them.
Absolutely. I mean, Pat, when I think about it, it's such a frightening concept, even if the surgery is done and is successful, to know what to do and where to turn to. Having you there must be such a comfort for not just the patient, but the patient's caregivers. And you must get to know these people over a long period of time, too, because the treatment doesn't just is just not post-op. Do you stay with the patient for a period of time through
Yes,
the
we
entire
do.
treatment period?
Yes, we do. And it also, after the treatment is complete, we do. We stay
You
with
do
them.
as well.
Mhm.
You must become very good friends.
I do.
I have to say, generally, when I see patients in follow-up, they often don't talk about myself or Dr. Jekyll. They all ask about Pat. Pat's the glue that keeps the program together and keeps the patients going. I mean, she's great. She's been doing this for a long time, and she's really offers a wonderful service.
Well, Pat, you must be an angel, and I'm sure many people think of you as an angel who's guided them through this very difficult part, and God bless you for doing that. That's absolutely wonderful.
Thank you.
So now you are there, you're making appointments, you're giving information, you're trying to educate them as well about, you said, nutrition and what are perhaps even adjusted lifestyles. I don't know whether, do people have to change their behavior and lifestyle after they've had surgery or a brain tumor? Do they have to put down their cell phones?
That's a question that hasn't been answered, I know.
And you know everybody thinks that cell phones cause brain tumors, but you're negating that, or you say you don't know.
No, right now we don't know if there's
Right.
any relationship. It's never been
Right.
proven.
Oh.
But Pat does help coordinate. There are lots of services that are offered at the Brain Tumor Center.
Right.
Yes, tell us about a few of those services.
Well, we have two dedicated, the Cancer Center has two dedicated social workers. One is for adults, one is for pediatrics, which
Oh, of
is
course.
is very good. And also we have a nutritionist. So for any people who are interested in, different type of eating or a different type of meal plan, I guess, or different nutritional supplements, that can certainly that need can be met during the whole time that they come to visit us. So it's sort of like you come to us and we can have you meet with the social worker, we can have you meet with the dietitian. There's many programs that are offered that meet the spiritual and physical and emotional needs for the patients and their caregivers. It's not just the person who has the illness, but also those loved ones who are with them. So it's comprehensive. It's a very comprehensive program.
Well, I think you bring up some outstanding points here, that you're dealing with the whole person, not just a person who's had a surgical procedure or a brain tumor, but you're treating the whole person in many areas. I bet you even try to get them to stop smoking if they're smokers.
We do. We do.
Yeah. So this is wonderful that you do guide them to social work. And most people would not have thought that a social worker is necessary for a person undergoing this type of treatment. And why would that be necessary?
Well, the social worker provides many services, and certainly a social worker could answer this much better than I, but she can provide support services if they need it due to insurance issues or whatever. She can provide emotional support. Anyone who comes into the Cancer Center has the ability to meet with a social worker and just talk with that person in a professional way and discuss what's going on and help to process what's happened to them. And that's true both for the person who has the illness as well as, once again, their caregivers. It's a lot to process, and it helps to have someone who is a professional, who is objective, you know what I mean, and not necessarily involved. And and it's also good just to listen. I mean, listening to people who are having a new diagnosis that can be very daunting. That's, you need a good set of ears.
It's earth-shattering.
Right.
Yeah.
It's earth-shattering, and you listen to those people and their caretakers, and you're providing, well, first of all, education gives you a sense of comfort in a way that you can grasp your head around what's going on.
Right,
And
it
that's
does.
what you're doing. You're providing comfort through your education, through guiding them. And of course, some people don't even know how to dial a phone at that point, and you're making those appointments for them. That's fantastic. That is really wonderful. So that is great. You do navigate them, you take them down the path, and you're making their lives easier.
Mhm.
and you're making their lives easier.
Mhm.
So as you're making their lives easier and you're bringing up the caregivers, we do have the patient and their caregiver still going through that emotional trauma, right? And Claire, you're the coordinator for the Center for Hope. And I love that name because most people don't put brain tumor and hope together, but
Sure.
it's there. Isn't that right?
Absolutely, and I certainly can't take credit for the name, but it was the Center for Hope was founded in 2012, and so we've been running this program since then. We meet once a month. We get together. We host a space for patients and their caregivers, and by caregiver it can be really anyone. It doesn't have to be a spouse. It could be a family member that's important to them or a friend, anyone that can kind of help them through what they're going through. And we get together and we're a little non-traditional. We actually eat dinner together. So I think what better way to foster closeness than to eat together?
Would you call this a therapy group?
No, it's a support group, but it's just a little bit non-traditional. So we're really there to talk with each other in kind of a non-formal way. So it's casual. Patients and their caregivers can talk about their treatments they're going through, their doctors, what they like, what they don't like, their vacations. It's a way to provide hope because there's a wide range of people going through this. People who have had surgery maybe years ago, maybe people who have just had surgery, or maybe they're in the middle of chemotherapy and radiation right now. So you can say, I've been through this and you can get through it too.
Oh, so I'm getting the picture. So you have a group of people that meet once a month and talk. It's not a formal therapeutic center, but it gives people an opportunity who have shared or are sharing the same problem to talk about it. Maybe give tips to their, if they've already been through it in that phase, they'll say, well, please be aware of this, or don't eat grapefruit or whatever, because it counterindicates a certain medicine or something. That is comforting, but I'd like to know something. If you're going to talk about maybe your doctors or your loved one or somebody over there, aren't you afraid that somebody's going to go out and spill the beans about this?
No, it's a really, privacy is of utmost importance. So this is a place where, maybe you haven't been sharing your diagnosis with your friends or your family members and you just don't really want to put that out there. So this is the place where you can come get together with other people who are experiencing the same thing or similar thing, or they can relate, and you can say whatever you'd like because everyone is really...
So you're saying that these wonderful informal sessions are still confidential?
Absolutely.
And the only reason somebody's going to talk about it is you yourself want to talk about it to somebody else.
Sure.
But it's not going to emanate from the people who get together, and they do respect that, don't they?
Absolutely, yeah.
Okay, so you're providing an opportunity for people to talk about their illnesses, and I brought up the word success. Is there an opportunity for people to say, this is a horrible diagnosis, it's scarier than anything else? I think when you hear about a brain tumor, I think it's about as frightening a diagnosis as anybody can get. But you're saying that there's hope there, Center of Hope,
Yes.
that there's hope there that one can get through everything with Pat's help and the doctor's help and everybody over the nation who do the similar thing and live a successful life. Is that what you're saying?
Absolutely, and that's part of what the group does for the patients, is to show you that, look, I've been through this, I'm going through the same treatment, or I've been through the treatment that you're going through right now, and this is how I dealt with it, and I got through it, and I'm still working. If I'm able to, if my doctor says I can, I'm driving, or however I'm getting through my life. But, and it's same for the caregivers. The caregivers are able to say, gosh, this is difficult, but this is how I'm getting through it.
I think you're bringing up a very good point, because the patient is a person who is obviously very weak. Maybe they're just recovering from their surgery or their chemo or their radiation, And the caregiver's got to be the strong person and cope with that patient when they go through their emotional ups and downs. Obviously, somebody might even be depressed, they may be tired, but the caregiver does so much on behalf of the patient. Are you there for the caregiver too?
Absolutely, and we try to, and I think, I think a very important part is taking care of the caregiver. So a lot of times we'll actually separate the patients and the caregivers and let the caregivers vent and let the, so everyone can kind of
that's
talk
interesting.
candidly.
Really?
Because they're dealing with different struggles. So it's.
So you let the caregivers have a chance to just let it all out and talk and commiserate or support. And I bet they even get together afterwards too.
Oh, yeah. Some of them
It sounds
do.
like people
become
might even
close
become
friends.
friends.
Do.
Yeah.
Friends
They
and
do.
like family. They say it's like family, and it's not just patients and caregivers sharing information. We bring outside people in as well, and
okay.
just kind of like what Pat was talking about with the center. We bring. It's kind of multidisciplinary. So we have social workers maybe come in, or a nutritionist come in, or massage therapy, or financial planner. We've had the neurosurgeons.
That's a very good point, because I think a lot of people forget that in a crisis like that they should be protected legally too. I mean, there's a lot of, this is society where everything is documented. So, you could even bring up the point of wills and power of attorney and all those things, which are a very important part of being survivors, but also helping your family members out too. That's reality. That's our reality today. So I'm glad to hear you bring that up, because it's a very important point to know that a person going through that will have the comfort of knowing that he or she are providing for their loved ones now or in the future.
Sure.
Is that right?
Yeah. It's complicated. It's messy, but it's good to have some advice.
So what I'm getting here from Dr. Moshel, Claire, and Pat is that you're a team, and your goal is to
Give people hope.
Yeah.
I
give
think that's-
people hope.
and make them feel and know that they're not going through this alone.
Right.
And I think, I always step back and look at our patients, and I'm always impressed at how people rise to the occasion. And they always do, some in ways that shock me. I know I'm not sure I'm strong enough to do that, but I think Pat and Claire are the vehicles and the agents that help people reach that point.
Okay,
And that's how I look at them.
and that's wonderful. So I congratulate all of you for everything that you do. You're wonderful, you're extraordinary people, and thank you for joining us today on 30 Medical Minutes. Hope to see you again. Thank you.